This slide shows part 1 of 3 about managing your medications with Parkinson's disease. If you have been recently diagnosed, you may not have been fully informed about the implications of taking these drugs. If you have had Parkinson's for any length of time, you might gain a better understanding of the effects of these medications and the treatment options available. There are several types of medication available to treat this condition. We are not going to cover all of them in detail, only the most common and, more importantly, the ones that work. The first point that must be made absolutely clear is this. Once you begin a drug regimen for Parkinson's, there is no going back. The effects of many of these medications is still not fully understood. It is actually unknown how many of them work. Controlling the negative side effects is a complicated matter and requires a lot of trial and error. Surgery may alleviate some symptoms, but there are side effects, and you will still require daily medication. Some physicians are suggesting not treating mild cases with any drugs at the onset. Instead, there are lifestyle changes that are recommended to cope with the disease. This presentation is about the drugs and how to manage them. At some point in the course of this disease, you will have to take medications. Unfortunately, that's the reality of it. There is currently no alternative. There are many claims of treating or curing the condition holistically. This is patently false. There is no home brew or natural alternative that will alter the course of this disease. You can improve and slow the condition through lifestyle changes, but you cannot change the biological nature of the disease. Parkinson's symptoms arise from the gradual loss of dopamine-producing cells in the brain. It is progressive over many years. You will not die from Parkinson's. The obvious solution is to supplement the brain with dopamine. This leads us to our first and foremost medication, levodopa. Levodopa is a chemical that is converted into dopamine in the brain. It is a building block of sorts. Unfortunately, levodopa is what is called protein competitive. This means that proteins can offset and or nullify the effects of the drug. This becomes a growing problem over time as levodopa alters certain digestive enzymes, making absorption even more of an issue. Levodopa alone cannot readily pass through the blood-brain barrier as dopamine and is absorbed through the small intestine. Gastric emptying is more important to absorption than protein competition. Take levodopa on an empty stomach for it to be more effective. It takes about 30 to 45 minutes to absorb. Wait, there's a catch. Remember that levodopa does not readily pass through the blood-brain barrier. It needs a helper called carbidopa or lodocin, which is a decarboxylase inhibitor. So what is a decarboxylase inhibitor? It's a chemical that inhibits levodopa from being converted into dopamine before reaching the brain. It prevents peripheral absorption of levodopa into the muscles. This is critical in Parkinson's treatment. Carbidopa never does cross the blood-brain barrier, only levodopa. It all sounds so simple, doesn't it? Carbidopa is officially added to levodopa to prevent nausea. This, unfortunately, is not entirely true. Carbidopa also inhibits the metabolism of vitamin B6, which is not a good thing. Taking B6, paroxetine, will nullify the effect of the carbidopa. They counteract each other, and there is controversy to this. If carbidopa does in fact inhibit B6, this is a huge problem. B6 is critical for hundreds of functions in the body. Carbidopa has been studied as a weight loss drug. Fact: I personally documented weight loss of 30 pounds within 6 months of initiating carbidopa-levodopa therapy. 15 pounds of that was within the first 6 weeks with absolutely no lifestyle changes. Taking a 25 to 100 ratio of carbidopa-levodopa, I hold a consistent weight of 160 pounds no matter what I do. Taking a ratio of 25 to 250 increases my weight by 10 to 12 pounds within 5 weeks and can be maintained. I consume a minimum of 5,000 calories daily. Nothing else changes in my diet, activity, or any other aspect of my living. Let's get back to levodopa.